The intended purpose, or why should we be using the device, is central in establishing the classification of the device. The intended purpose must be defined by the manufacturer based on the data they have available to support it, and it's key in determining the classification of the device itself. The intended purpose needs to be specified in the instruction for use and also in the device technical documentation. The guidance also specifies that if there is a risk that the device may be misused, for example, used for other indications different from its stated intended purpose, a clear limitation of use should be included in both the instruction for use and the device technical documentation. One important point that I like to highlight, and it's also explained in the guidance, is that the same device could fall into different classes depending on the intended purpose. The example that is provided in the guidance references syphilis, a syphilis device, which could be class C if used to detect sexually transmitted disease, or class D if it's used to evaluate the suitability of a donation, a blood donation or a tissue for transfusion or transplantation. Another interesting example is the case of influenza. If the device is intended to be used to detect the presence of highly virulent pandemic influenza, it will be class D, according to Rule 1. But if it's used to detect a non-pandemic influenza, then the device would be class B, according to Rule 6.